Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy and I am the Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor.
And my name is Malcolm, a former surgeon and presently chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk about breast cancer awareness. To help us with this we are joined by Angie Aire, who is a volunteer with Breast Cancer Now here on the island, and like Sandy, a breast cancer survivor. Angie has been a fervent campaigner for improving outcomes in breast cancer over many decades, work for which she has been honoured with the award of an MBE.
Breast cancer is cancer that starts in the breast. It is the most common form of cancer for women, with 1 in 7 women receiving a diagnosis of breast cancer at some point in their lifetime, resulting in around 80 to 100 ladies each year on the island developing the disease. Although it can affect women of any age, it is more common in ladies over the age of 50. However, it is readily treatable, as exemplified by Sandy and myself, particularly if ladies come forward early when they notice something different or unusual going on in their breasts.
So let's get down to what ladies should be concerned about and when they need to seek medical advice early. A lump or nodularity in the breast is probably the most common symptom, which is often, but not always, painless. Dimpling or puckering of the skin over part of the breast, a nipple discharge, particularly if it's bloody or brown, a rash or crusting affecting the nipple, and occasionally pain, redness or inflammation of the breast. Having any of these symptoms does not mean that you have cancer. 9 out of 10 ladies seen by a specialist with a lump have benign disease, but it is imperative that you seek advice.
Yes, it is vital that ladies seek medical advice at an early stage. Nearly all ladies with stage 1 or localised disease are alive 5 years after their diagnosis, but only a quarter of those ladies with the disease that has already spread. So for me, I was diagnosed with breast cancer in 2002. I found a lump whilst washing myself in the shower. I told my husband, and it's important to tell somebody about your findings, and I went off to the GP, who sent me to the breast clinic for a mammogram and scan. Not believing it was breast cancer, it was a shock to be told you have breast cancer. I had surgery here in the Isle of Man, along with chemotherapy and radiotherapy in Clatterbridge. Excellent treatment throughout my experience, and I'm here to spread the word about checking yourself regularly and be breast aware, because early diagnosis saves lives.
There is also a screening programme for breast cancer which has been running for several decades. Screening allows tiny changes in the breast to be detected before a woman would be able to feel or see any difference to her breast. This means that it can detect breast cancer at a very early stage, and as we've said before, the earlier cancer is detected, the easier it is to treat.
So screening provides an excellent opportunity for ladies to have their tumours discovered before they are aware that anything is awry, or reassure them that all is well. It is not appropriate for ladies who have symptoms already. They should see their GP or practice nurse. On the Isle of Man, women aged between 50 and 70 years old are invited to attend screening every 2 years, with those over the age of 70 able to self-refer. Screening is done through having a mammogram, like an X-ray of the breast. When you are sent your screening invite, there will be a leaflet enclosed which will explain all about what happens during screening. I know some women are cautious about going for screening because they've heard that it can hurt. For some, having a mammogram can be uncomfortable, but it's very quick. Remember that a mammogram can detect very early signs of breast cancer. A few seconds of being uncomfortable could potentially save your life.
And it's also important for ladies to examine their breasts regularly. Think TLC, which is touch, look, check. Touch your breast. Can you feel anything unusual? Look for changes. Is there any change in the shape or texture? There are a number of websites that can guide you through how to examine your breasts. Check anything unusual with your doctor or your practice nurse.
It's also good to have an understanding of factors which might increase your risk of developing breast cancer. Those over which we have little control include age. Breast cancer becomes more common as we get older. Biological factors such as an early menarche or onset of periods and a late menopause, having previously had breast cancer or certain other breast conditions. And a family history of breast or ovarian cancer also increases your risks, as there are several genes that have been identified with a high risk of developing breast cancer. So if you have a number of members in the family with breast or ovarian cancer, particularly under the age of 45 years, you should seek advice. Factors that you may be able to do something about include lifestyle, being overweight, particularly after the menopause, drinking alcohol very regularly, or smoking, all increase the risk of developing breast cancer. Not having had any children, having children later, or not breastfeeding also increases the risk. And taking hormone replacement therapy, or HRT. Some women may need to take HRT for menopausal symptoms, but such treatment should be reviewed regularly and withdrawn when no longer merited. We've talked so far about ladies and breast cancer, but it's important to remember that breast cancer can also affect a small number of men, around one man on the island every other year. Men in particular seem entirely unaware that they possess breast tissue. Where there is a nipple, there is always some breast tissue behind it. In men, this breast tissue is normally dormant, but in the presence of even small levels of female hormones, as occurs around puberty, it enlarges and may give rise to some tender nodularity behind one or both nipples, a benign condition known as gynecomastia, which usually disappears spontaneously with time. So men, too, need to be vigilant about breast cancer.
So let's recap on the symptoms of breast cancer. A lump or nodularity in the breast. Some dimpling or puckering of the skin over part of the breast. A nipple discharge, particularly if it's bloody or brown. Or a rash or crusting affecting the nipple. And occasionally pain, redness or inflammation of the breast. If you have any of these symptoms, please do not hesitate to go and see your GP.
If you want to find out any more information on breast cancer, you can visit the Breast Cancer Now website, which is breastcancernow.org, or you can contact the Macmillan Cancer Information Centre on telephone number 650 735, or their website is cancer.org.im. And for women over the age of 70 who would like to self-refer to breast screening, you can arrange this by telephoning 685 339. Thank you for listening to this podcast.